Welcome to the annual vaccine training for facilities receiving state-funded doses, presented by the County of Santa Cruz Public Health Division. The following presentation contains several resources and links for your use. Please download the slide deck for your reference. The State General Fund, or SGF program, supplies limited vaccines to prevent respiratory illness as a safety net for vulnerable Californians, bridging gaps left by federal programs. SGF primarily supplies seasonal influenza vaccines, but at times funding covers other vaccines, for example, in the event of an outbreak. Vaccine offering varies depending on funding. There are no restrictions as to whom is eligible to receive SGF vaccine. However, providers are encouraged to prioritize uninsured and underserved adults not otherwise covered by VFC, Medi-Cal, or private insurance. Providers order a vaccine through MyCAVax. Eligible providers include state-licensed community health centers, federally qualified health centers, rural health centers, health departments, and CDPH-approved health department authorized sites, as well as private providers and school-based clinics. Here are some preliminary data from CARE reflecting flu vaccine coverage in Santa Cruz for the 2025-26 season. Overall, about 33% of Santa Cruz residents are up to date on their flu vaccine. This is pretty typical for us. The data is likely somewhat of an undercount as not all flu vaccines are entered into CARE. By race or ethnicity, the lowest flu vaccine rates are seen among American Indian and Alaskan Natives, Asians, Black and African Americans, and Latino populations. Multiracial, Native Hawaiian, or other Pacific Islander and white individuals were more likely than other groups to receive a flu vaccine. In SGF provider sites, designated vaccine coordinators are responsible for implementing a vaccine management plan, while the provider of record is ultimately accountable for the practice's compliance. The vaccine management plan details routine tasks that providers and key practice staff must complete to protect vaccines and minimize loss. The plan also provides a blueprint for responding to emergencies such as wildfires or public safety power shutoffs. Every fall, SGF providers must submit their updated vaccine management plan to Santa Cruz County Public Health as a requirement of participation. To assist providers, the California Vaccine for Children program offers convenient online EasyIZ training for staff involved in vaccine management, including storing vaccines, monitoring storage unit temperatures, preparing vaccines, and administering vaccines. A training on conducting a vaccine inventory is also available for vaccine coordinators. All key practice staff who will be involved in the storage, handling, or administration of SGF vaccine must complete EasyIZ education modules at least every 12 months. Please provide copies of your team's completion certificates for the listed modules. If you have never taken these courses or it has been more than a year, please complete them as soon as possible and email your certificates to Public Health. Please plan to send updated certificates when due. Note that you are not required to submit training certificates to Public Health for SGF if you are also a VFC provider. As of June 2026, EasyIZ has a new website. Please update your bookmarks. Note that EasyIZ training requires that you create new accounts for every identified key practice staff. Please use the same email address that you use in MyCAVax. Learning history will not carry over to the new website. If you have already completed your required training, no further action is needed until the next recertification period. For VFC providers, when creating new accounts, please ensure that staff include your program location's PIN to facilitate MyCAVax integration. The EasyIZ website also has dozens of job aids available. There is a link to all job aids here in the title. Please review relevant job aids on storage and handling policies, vaccine storage units, digital data loggers, temperature monitoring, vaccine transport, vaccine orders, inventory management, and sticker printouts are also available for quick identification of vaccine funding source. For any technical assistance requests regarding SGF, MyCAVax, and My Turn Clinic, you may contact the provider call center by phone or email. The California Immunization Registry, or CARE, is a secure web-based database that stores immunization records for children and adults, helping healthcare providers keep track of vaccination statuses and ensuring community health. It supports public health efforts by providing a centralized source of immunization data. State law requires California providers who administer vaccines to enter immunization information as well as race and ethnicity data into CARE for patients who receive immunizations. Please enter all SGF vaccine under State General Funding Category CA001. Mid-season accountability reports for SGF flu are typically due in February. These are required to help local health departments and CDPH utilize vaccine as soon as possible. In July, please return expired flu vaccine through MyCAVax. New in 2026, SGF providers will recertify through MyCAVax. This year, on July 1st, providers received notification from the state that recertification opened. During the process, providers sign and agree to updated requirements to maintain active accounts. Keep an eye out for annual program letters and other communications that guide providers through all aspects of the recertification process. Recertification closes in MyCAVax on September 30th. This concludes our annual review for SGF providers. Please download the slides to review links and resources and reach out to us with any questions at immunizations@santacruzcountyca.gov.